Welcome. Important questions. What skin change characterizes grade 3 radiation reaction? Which system is universally used for grading prostate adenocarcinoma? For Hodgkin and non-Hodgkin lymphomas, the most widely used clinical grading or staging system is which feature is not typically part of soft tissue sarcoma grading? A 55-year-old man has a high CA19-9 level. Which malignancy should be suspected first? Which blood test is most useful for detecting blood cancers such as leukemia? Tumor markers are most reliable when used for which marker is commonly used to monitor treatment response in colorectal cancer? True or false, a normal blood test rules out the presence of all forms of cancer. What cancer is mainly associated with chronic infection by Helicobacter pylori? Which two viruses are main causes of hepatocellular carcinoma? Kaposi's sarcoma is caused by infection with which virus? Which cancer is most often associated with Epstein-Barr virus, EBV, infection? Which parasite is linked to increased risk of bladder cancer? Which virus is most strongly linked to cervical cancer? The principal viral cause of most cases of anal, oropharyngeal, and genital cancers is which age group is most commonly affected by Ewing sarcoma? What is the defining cell seen in Hodgkin lymphoma, but not in non-Hodgkin lymphoma? Triple-negative breast cancer is defined by the absence of which receptors or proteins? The first linear accelerator, LINAC, for clinical radiotherapy was introduced in which decade? Radiation-induced lymphedema in gynecological cancer patients presents as radiation necrosis of the brain typically occurs. Which skin change is most frequently seen after radiation therapy for breast cancer? The first successful clinical brachytherapy treatment was performed on which type of cancer and in which year? Which best describes the prognosis of triple-negative breast cancer compared to other breast cancers? What is the significance of the ISO center in modern radiotherapy machines? The term brachytherapy originates from which language and signifies what? Why is hydration important during head and neck radiation therapy? Which of the following statements about the spread of Hodgkin lymphoma is true? Which statement is true about viruses and cancer? Which of the following best describes a grade 2 astrocytoma? Which WHO grade is assigned to glioblastoma? Which population is most commonly affected by epidemic Kaposi sarcoma? What is the most common type of primary brain tumor in adults? On X-ray, which periosteal reaction is characteristic of Ewing sarcoma? Non-Hodgkin lymphoma is more likely than Hodgkin lymphoma to. Who is credited as the first to use X-rays therapeutically to treat cancer?